Powerful muscular organ situated in the cavity of the thorax, just to the left of the middle line. It is placed rather obliquely and is conical in shape, so that the apex lies forwards and to the left, while the base lies rather more posteriorly and in the middle line. The superficial area of the chest wall, beneath which the heart lies, is bounded by the lower border of the left second costal cartilage, the upper border of the right third costal cartilage, the junction of the seventh right costal cartilage, and the sternum, and a point in the fifth left intercostal space about ½ an inch inside the nipple line. If these points be joined, the area so marked out represents fairly accurately the position of the underlying heart. The apex of the heart lies just to the inner side of the left nipple line in the fifth intercostal space and can usually be felt beating in that position. The rest of the heart cannot be felt beating owing to the inclination of the organ away from the chest wall. The main structures in close contact with the heart, or in anatomical words, the heart's relations, are 1. On each side, the lungs. 2. In front, the lungs overlap the heart in its upper part, but there is a notch in the margin of the left lung which allows the apex of the heart to come forwards to the front chest wall. This part of the heart, therefore, is in direct relationship to the posterior surface of the front wall of the chest. 3. Behind the heart lies the esophagus. Below the heart rests on the diaphragm, which separates it from the abdominal cavity. Immediately below the part of the diaphragm on which the heart rests lies the left lobe of the liver and the stomach. Precardium. The heart is completely enveloped except where the great blood vessels enter and emerge by a fibrous bag called the pericardium. This is attached below to the diaphragm and so assists in keeping the heart in its proper position. Lining the fibrous pericardium is a thin layer of serous membrane called the serous pericardium. This forms a double layer, one lining the pericardium and the other covering the heart, so that the heart muscle does not come in direct contact with the fibrous pericardium, but is separated from it by the two serous layers, which are covered on their opposing surfaces by a thin film of fluid, and so provide smooth, lubricated surfaces, avoiding the friction which would otherwise inevitably occur during each heartbeat. Structure of the heart. The heart is composed almost entirely of muscle fiber and consists of 4 cavities or chambers, 2 auricles, right and left above, and 2 ventricles, right and left below. The right auricle and ventricle communicate with one another, as do the left auricle and ventricle, but there are no communications between the right and left auricles, nor between the right and left ventricles. The openings between the auricles and ventricles are valvular, allowing blood to pass to one direction only, i.e., from the auricle to the ventricle. The valves guarding these orifices are composed of extremely thin fibrous layers attached by their outer border to the circumference of the orifice and having a free inner border controlled by thin fibrous cords attached to the walls of each ventricle. The valve on the right side is called the tricuspid valve, as it consists of 3 flaps. That's it.
That's good. Sir.